Happy Facial Plastics Friday. Dr. Brace here. I'm cheating today because it's actually Thursday, but we're planning this post for tomorrow because I'll be taking my kids to a park. And what I want to talk about today was rhinoplasty behind the scenes. What happens before we get to the operating room? You'll see behind me, I'm doing a picture-in-picture video here, an example of a before and after. This is a 4-month after rhinoplasty result with a 3D camera. So this is Preoperative Imaging. I use the Vectra camera, which is made by Canfield, to take 3D images of people's faces to manipulate their noses for a conversation around rhinoplasty. This is the camera. And so what it allows me to do, there's a prism in this lens. You take 3 photos, it actually is 6 photos because of the prism. The computer stitches them together and then it gets a 3D model of the face. So you can see that rotating behind me. And what that allows me to do is look at somebody's preoperative nose or preoperative imaging and then make adjustments to their face. It's called morphing. So we morph the image to change their nose into the way that they hope it will look like. And then use those images as my guide in the operating room. So this isn't a guarantee of what your nose is guaranteed to look like, but it is a roadmap for me. So if somebody wants their nose pushed back and the tip lifted up and the bump taken down, use the pre-op imaging for a conversation here to get an idea of what exactly they want. It gives the person an idea of what their nose will look like after surgery, but it tells me exactly what I need to do. So every maneuver I make in the imaging corresponds to a surgical maneuver, and I actually write that out. So after a rhinoplasty consult, I will write out an operative plan of all the moves that I want to make in that surgery. And that serves a couple of purposes. Number one, it guides me in the operating room, and number two, it's good for conversation before surgery. So it's often weeks or even months when I see somebody before I operate on them. So when I see them again before surgery, the day of, I'll sit down and say, okay, this is what we talked about. We're gonna change the profile. We're gonna lift your tip up. We're gonna set it back about 3 millimeters. We're gonna do X, Y, Z. Is that still the plan? Are you still okay with that? We'll look at the pictures together, and sometimes, not often, sometimes people will say, you know what, I don't want to do that part anymore. Can we do less of that or more of this? And so it facilitates that conversation. So I love the Vectra camera. It's a really helpful tool to discuss rhinoplasty and what the results will likely look like, potentially look like. Obviously, there are things out of my control. If someone gets hit in the nose, or if they have a lot of swelling or scarring that may need intervention, that may not make it exactly like that. But when I'm operating, I'm looking at those pictures and I'm using that as my guide. The pictures get taken against a blue wall. So that's my little photo corner with bright lights. I'm in a windowless room, so I need the extra light. And a lot of people ask me why blue. It looks very kind of medical, and there's a good reason for blue. Blue is actually the opposite color of red, and red is the most common or the most prominent tone in our skin. So when you take a picture of someone's face against a blue wall, their skin stands out. So it just lets us see the face even more clearly. So you can see rotating behind me, there's that before and after. So this patient of mine is 4 months out. You can see great result. That's not a morphed image, that's actually her surgical result. She still has a bit of swelling in her tip, but you can see from the Vectra camera and those 3D images what her nose looked like before and what it's looking like now. And we'll take them again at around 6 months and a year, and we'll see how her nose has changed. At the end of this little video, I'll show you a quick video of our patient from last week, and she had her stitches out and her cast off today, and she's looking great. Her tip is pretty swollen. The cast was compressing her nose, so the swelling is down there, and she has a little bit of yellowish bruising around here, which is pretty normal at day 6. So if anyone's wondering, you know, what does somebody look like after that surgery that I showed last week, well, you can have a look. That's it for today. Send us your questions. I'm gonna try to prepare stuff in advance for our stories next week and going forward. So I think for next Facial Plastics Friday, I'm gonna talk about scar revision. Happy Facial Plastics Friday.